Hi, and welcome to On the Spot. My name is Ronnie Wiley. To my right is Missy Kavanaugh from the Fayette County Health Department. Hi, Missy. How are you?
Hi, Ron.
Good. Great to have. We got to figure out how to. I feel like I'm being dragged over the desk. I like this desk. Missy's from the Fayette County Health Department, and you've been there for how long?
I've been there 2 years now.
2 years. Mm-hmm. Okay.
Yes.
Okay. And you've been you're a lifelong Fayette County resident.
Yes, I've been here all my life. I graduated in 1981.
You don't need to tell us what year you graduated. I thought it was 1991.
I wish. But I did various jobs after school and stuff, and then I led into the medical field after talking to my sister and brother, which they're both in the healthcare field, and it just seemed like it was just kind of a more secure career choice at that time.
So it wasn't something that you, like when you were a kid, you aspired to be a nurse?
No.
Yeah.
I really wanted to be an artist, but that didn't work out.
Do you do any artwork?
Yeah.
What kind of artwork do you do?
Well, right now I have a balloon business.
Oh, good.
I do like balloon arches and stuff. It's called Balloonatic Ballet.
Balloonatic. Oh, that's an awesome
I got a little.
Got a little plug in there for the Balloonatic.
Yeah, that's cool.
So are your customers balloonatics?
They can be.
They can be. You can be a balloonatic with Missy. Well, let's talk about that real quick. Where's the balloonatic located at?
Well, I do it out of my home.
You do it at home?
Yeah. I build it at home, and then I take it to the venue wherever they're going to have their event at.
So, this took we didn't even talk about. Usually, we do pre-interviews, so we didn't talk about this at all. So, tell me something about the balloonatic. Is it? Because I'm thinking like you make animals out of the balloons.
Well, no, I make like the big arches.
Okay.
The
for like weddings?
Yeah. Well,
okay.
I haven't done a wedding yet, which I'm hoping to do. But I do like birthday parties, showers, bridal showers, any type of party that you guys, anybody would want, you know.
Yeah. So you can do.
I've been doing that for like a couple of years now too, almost.
Yeah. So you can do those like gender reveals. Mm-hmm. Yeah. Wow.
Yeah.
Balloonatic. I like that. That's wow. We probably need to have you on and show us how you,
that'd be
do
cool.
that stuff.
I'd be more than happy to do that.
For the Balloonatic's. But we're here for the Fayette County Health Department.
Yes.
We may get back to the Balloonatic's because I like that a lot. So when you were artist starving.
Yeah.
Obviously.
Pretty much.
Yeah. And
I wanted to go to art school, but it was like unrealistic tuition.
Mm-hmm.
I just couldn't afford it. So I ended up just doing any type of job I could get and stuff. And you get into your 30s and it's like, I better get serious about picking something.
Mm-hmm.
So I did a few things that I thought I liked, but then I ended up talking to my brother and sister, and it was a better career that I chose. And so it's panned out real good. I've been doing it for 15 years. Now, so it's definitely a secure place in the market.
Yeah. So is it everything you thought it would be, being a nurse?
It's a lot more than I thought it'd be.
Wow.
When I started my career, I started out as a psych nurse.
Oh wow. Okay. Yeah.
I worked at Richmond State Hospital for like about 7 years.
Yeah.
I loved that job.
Yeah.
That was a very, very interesting job.
Never is the same ever. I worked in mental health for a long time.
It's a beast in itself, but it was never a dull moment.
Yeah, no.
I mean,
no.
But I loved it, and then I went on to. I did a little med surge. Then I went back to the psych. And then I started doing travel nursing, and then I went back to med surge, and then I just ended up at this health department. The bedside nursing gets a little hard after a while.
Right, sure.
On your physically and stuff. Yeah. So it was time for me to start looking into it more like case management and desk work. So that's how I ended up at the health department. I had volunteered when COVID first came out. Mm-hmm. And so I was one of their part-time nurses that helped with the administration of that. So I got introduced to it down there, and then when I left Reed, a position came open down there, so I hopped on it, and they luckily hired me.
And what's your official title?
I'm the public health nurse now.
Public health nurse, okay. I
was the school liaison, and then Amy Full, that was the nurse prior to me, she resigned and went to another job, and then I took her position.
And what exactly does your position entail? What all do you do?
Well, kind of over the nursing staff and just basically serve the public. We do like immunizations, any of the vaccines that anybody needs, and naturally we're in the flu season and COVID, so we do those. And then any type of healthcare education. We have smoking education. We are doing testing now. We did have a service of the HIV and Hep and STD, but we lost our guy, but we have somebody in office, so we're getting ready to reboot that back up here probably about another month or so. But our new service that we have is low-cost lab work.
Yes.
So that's what I was like, really like to brag on. We've been working on this for a little while, about 3 months. We actually got introduced by it with Henry County Health Department. They've been doing it for years, and I had no knowledge that that type of service was available. And luckily, one of our staff members was at an event with somebody that worked there, and they had given them a flyer. So I reached out to their nursing director up there, and he coached me through it and held my hand and got me introduced to, it's through LabCorp. We're contracted through LabCorp. And so we can do basically like your annual screenings that you get at a physical.
Right.
Whenever you go and have your annual physical, but we can do, on my list here, we have lipid panel, comprehensive metabolic panel, and then the health panel, which the health panel is what usually you get, with your health screenings. And then we have the add-ons are the A1C, the TSH, and PSA. Those are like for more conditions that you like kind of monitor through the year and stuff like that.
Right.
But I mean, we have them at such low prices that it's. I'm just really proud of it that we have it to offer the public.
Very amazed at the prices.
Because like the lipid panel is only $35, and that includes your lab draw fee. The CMP panel is $40, and then the health panel, which is like what I said on your annual physicals you get, that's $75.
Yeah, and it looks like it's like the lipid panel, it covers your cholesterol, and I don't know these initials, but and then
it's your good and bad and everything that has to do with your cholesterol.
How do you pronounce that? Triglycerides?
Triglycerides, yeah.
Hey, wow, that's amazing. And then the comprehensive, it looks like it covers some of that and then some.
That's mostly like your electrolytes and things like that. And then your health panel. Your health panel really consists of all these tests that are on this list, and that's what usually gets run on during your annual physicals. So the health panel, it does because the A1C is on that, and all the cholesterol. Yeah, wow. And then for people that are diabetic out there, a lot of times the doctor would like to stay on top of their blood level, their blood sugar, and they usually will have that done. I guess it just depends on, how severe it is. A lot of times they have them done like every 3 months just to see how their level is, and that's only $12.
Yeah.
But with these three down here at the bottom, they're what's considered as an add-on lab, so you are charged a $20 lab fee. But for that, for each of those labs, it's still minimal.
Yeah, very much so.
Yeah, we were having a discussion at our health board meeting last night, and our doctors, in which some of them work with Reed, they were impressed with this. They were like, you can't get away even near what any hospital would charge you. So
very much so.
It's nice that we can offer this to the public. Unfortunately, we don't run it through insurance. We just take cash, credit card or debit card.
And there's no qualifications. No. Anybody can get in.
Anybody can do it. If you just want to know what your labs are, you can come in. You don't have to have a doctor's order for it. So, and then all you got to do, we do it the first and third week of the month, and we do it from 8:30 in the morning till 11:30 in the morning. So we do kind of have a certain window on that when it comes to the labs, because we have to make sure that the other parts are covered whenever somebody's doing a lab draw.
So that's what Monday through Friday.
Yeah.
Okay. First and third week of every month. When you think of the health department, at least when I think of the health department, lots of things go through my mind, but nothing really one thing settles. But there's a lot of things that you guys do that the general public doesn't know about. And we were talking before we went on the air, and again, the lunatics wasn't one of them. That's how I found out one of my kids. We went down there for, you guys do pregnancy tests.
Yes.
Yeah. So a lot of people don't understand that. And now I don't remember if that costs or anything. I don't remember.
Usually that's free.
Okay.
Right now,
it was a long time
we don't
ago.
do it that in house, but we will provide you with the test.
Yeah, okay.
We can't hand that out for free. But like I said, once we get the other tests going through the state, we will be able to perform that.
Okay.
So
so you guys provide like the packets, the pregnancy
the
test?
pregnancy test, yeah.
Yeah. Back then, it was like we found out right then and there to be on the stick, I guess.
So we're getting ready to boot that back up, and then of course, naturally we offer the kids immunizations. We do that. We do that every day of the week, all year long. And
now, is there a cost associated with that?
well, you have to bring your insurance card, and insurance covers it. Yeah.
Okay.
So, but we do have a program that if you aren't insured, we make sure you get them. We do have like I forget what it's called, but it's a funding that the state has to make sure that the child's immunized. And actually, we even have it for our flu shots too, flu and COVIDs.
I remember when I was working down in Brookville, and I had my TB test, and I was up here because we were off on Fridays, and that was when the 48-hour, and I thought, I don't know where to get it read. And I came to you guys, and you guys read it for me.
Yeah,
you may have done it, now that I think about it. Yeah, but anyway, I remember, and I was like, I don't know where to go. And so you guys read it for me.
Yeah,
so
if
you
you
guys
miss
do a
that
whole
window,
lot.
you got to do it all over again.
Yeah, I was like, I don't want to, because I'll take a shot in anywhere, but that for some reason, that TB test, even though it doesn't really hurt.
We offer that too, the TB test. Trying to think what else. Oh, we teach a vaping class out at the high school.
A vaping? I'm glad I didn't have vaping when I quit smoking, because I'd be vaping. That's right. That's why because Miss Judd, Carolyn Judd, she was the nurse there at the time when I went there and got my patches to quit smoking.
Vaping's worse than smoking.
I think so.
Well, it's evidence-based. It's worse.
Yeah. Oh, wow.
So and that's what these kids don't understand. Some of them really will absorb the information in class, but some of them have their mind set that they're going to do it.
Well, right. When I smoked, it was, it ain't going to affect me.
Yeah. But I think after a while, whenever they realize they can't compete in sports, because it damages the lungs like 5 times more than cigarettes do.
Wow.
Because when you're inhaling it, they with the flavoring, you can inhale 3 times more than what you would a cigarette. And then, like if you ever notice, like whenever they exhale, I mean, it looks like a freight train.
That's true,
So they're taking in, and then the nicotine content is so much higher too.
Wow. Like I said, I'm glad I quit. I got this belly, but
and these poor kids, they just, I almost wish that they had a class out at the school that they would have to take just for a semester, just because there's a large population that vape out there, and the high school and the middle school, they have a strict tobacco policy.
I thought you had to be 21 to buy those anyway.
You do.
I mean, I bought them when I was underage.
So there's always a way to get them,
Yeah.
But
I just wish they'd outlaw them all the way. I mean, I thought I'd never say that because I smoked, but I used to always tell when I worked at the methadone clinic in Richmond, I'd always tell my patients that because we can hear the people in the next office. I'd say, "Do you hear that person over there muffling?" Yeah. Well, you know what they're saying? No, they're saying that it ain't going to happen to me. It's happened to the next guy. So you're going to be the one that's going to OD. So you need to think about what your choices are. And so, it's always
because they always lead into,
person.
When we're in the class, they do lead into, because the class is confidential, so therefore it's a little bit more relaxing atmosphere for them. So they do talk and they do share more and they wish there was other services out there offered but it's nice for the ones that you can reach because they don't realize. Because I always call it a recipe. Whatever formula they use to make the cartridges or what they put in the pens, I mean, because it changes so much, I can't keep up with like what devices they use.
Sure.
But I mean, it's designed to where it lags in your system. There's just like tar and nicotine, formaldehyde,
I thought
arsenic.
they didn't have that stuff in there.
Oh yeah.
Oh, what?
It's just at such a low level that it's not considered. I guess FDA doesn't consider it fatal. So.
Oh, that's nice. Yeah.
I mean, that's.
But the smoke is.
Yeah. So and it is definitely marketed to the younger population. I mean, anywhere from like early teens up to the early 30s, and because I mean, they make the devices to where they look like pens or lipstick cases.
Right,
or,
that's true. I've seen that. Yeah.
And the is it USB where they plug into the computer. Yeah. So you never know what they have. I mean, they can have it right in class, and the kids will talk about that they sometimes can get away with doing it in class, and I'm like, gosh,
Yeah.
So it breaks my heart that you have a lot of kids out there that are very talented, and it's a very addictive habit.
They get popcorn lung.
Yes, that's what really damages, because that's not reversible. It's irreversible.
Wow. Yeah. And what exactly is popcorn lung?
What it does, it damages. You have these little air sacs at the end of your bronchial branches. They're called alveoli, and what it does is it damages those little air sacs. It scars them, and they can't repair themselves. So therefore, you basically have permanent lung damage.
Wow.
So I mean, they've had cases where teenagers had lung collapse and.
Wow. Teenagers.
Yeah. So that's scary,
Yeah. Yeah.
But. Anyways, on a higher note.
Yes. So you guys help prevent that with your education, and there's a lot of education with the health department. Talk about some of the educational avenues that you guys have there at the health department.
Well, we have like nutritional education,
which I need.
And we partner up with a lot of different healthcare providers in town. As far as like educational, like a lot, I'm going to kind of dip into like insurance. We partner up with like MDYs, CareSource. There's different like Medicaids and Medicaids, I should say. They have navigators that we partner up with, and so we kind of introduce them to the navigator, and the navigator will get this person signed up for Medicaid, basically not do all their paperwork, but walk them through the paperwork to where they can get Medicaid through the state and stuff. So I think a lot of people that don't have insurance are under the misconception that they can't get any just because they don't have a job or they don't make enough money, they can't get covered, and which is untrue. If anybody wants to come to the office, I can provide them with any type of a navigator.
Now, what exactly is a navigator?
That's the person that will basically take your information, and they'll take that information, which will be like all your demographics, like your address, where you live at, your income, if you have any income, how many people in your family, and they'll provide that information to the family children's services with the state. So, and that's where they basically apply you for Medicaid, is what it is.
Right. Okay.
So. There's different ones that partner up with the state. Yeah. So, but there's really no reason why nobody.
Case management.
Yeah.
Yeah.
Yeah. So, what else? We give education on. We do case management on like a lot of communicable diseases that are in the state, because once they get diagnosed with it, they'll be reported to the state. Then the state bounces it back to us, so that way we can monitor it, and it doesn't lead into an outbreak or anything like that. So we do follow-up case management with that patient and stuff.
So you guys, because a lot has changed since, I moved here in '87, went 30 years ago with my ex-wife to find out whether or not we're going to have a kid. And so a lot has changed. Do you guys, with anticipation of things that you guys, like anything coming up that's exciting? I mean, because this is exciting. Any other things that are coming up on the horizon that you're allowed to talk about, maybe?
Yeah, I mean, we can talk about it. There's just a lot to, with the Governor Holcomb has introduced this new commission. It's called Indiana First Healthy Indiana First. I think that's right. But we have like all these. They're called KPIs, or key performance indicators. So it's basically what the demographics of your county. It'd be like obesity, smoking, trauma and injury, tuberculosis, infectious diseases. So that's what we work on. We try to work on each category as much as we have, just depending on our manpower. So, and if we can't handle it, well, the state has been so super great on helping us with the resources that will like back us up and give us the resources to give to our community or whoever's seeking, help. Because like if we have to monitor it, and we don't have any cases, just I don't want anybody to freak out, but like if we have a TB case, they help. They have a team. They have a team that helps us which naturally that person would have to be quarantined. So they have a lot of backup resources for us. So we're trying to get our county moved up in the health status in this state, because we're not in a good position
that's
at all.
what I was going to say. You guys are.
Fayette County's like 90th out of 92 counties.
Wow.
So that's
you guys promote
my
positive health, obviously.
Yeah, that's my goal, is to get that up, because we have, we have resources that we can provide people, or if we don't have them, we can help find them at least. Yeah. It's unbelievable what the state's like provided us. Yeah. So it's like, we can't help nobody until they come in and ask us, but we can keep putting on these events. Back in June, we had a health fair, which it turned out really good. I was really proud. It was my first one I put on. So we had like a lot of healthcare providers, and we had Reed there. We had some of the nursing home there. We had the senior center there. We had, it's not their transportation, but the transportation was there, so they were there to give out information. We had all the insurance navigators there. We had the police department, sheriff's department, DNR. So we had like all resources that people could come and get information to find out what they offer and what they could do for us. So, so we have them. We just need people to ask, and we keep on putting on events that hopefully will provide it.
And I think people, at least for me, when I think of healthy, I think, okay, I got to eat healthy, and I got to maybe go work out. But there's more to that. Getting your blood work done, checking that. Not smoking. There's a lot more to it, and you guys provide all of that. And so your goal is to obviously get the word out for that.
Yeah, there's help out there that's either free or low cost, or if you just don't know where to go to get established, we can help you.
Yeah.
Neighborhood Health Center, north of the ER, they're great. They in Centerstone and Meridian, they offer health services. I think a lot of people don't realize that.
Well, that's true too. We think physically health. We don't think of mental health as well.
Right. So they got it all covered. And with Neighborhood, Meridian, and Centerstone, they all, I think everybody's so afraid of having a big fat bill, which we all are. But they go by what you make, and if you can't afford to pay anything, then you don't pay.
Right.
So it's basically an income-based service.
And I'm sure a lot of them have navigators too.
Yes,
that
absolutely.
Can help you get if you don't have insurance, they can help you get.
And then they can also reach out and help get you connected with vision and dental. And then I'm not sure about transportation, but I know, and I don't want to put words in their mouth, I don't know which one offers it. There's a couple of them that do offer transportation, or they can give you a gas card.
Yeah.
So there's so much free resources out there that if anybody calls down at the office, I can
help you out.
Yeah.
And what is that phone number?
It's 825, I'm sorry, let me back up, 765-825-4013.
Yeah.
I do have like another event coming up
that
I want to brag about.
Please brag. I want you to brag all you want.
So we have another healthcare. Actually, it's a mobile flu clinic and a health fair combined that we are planning on September 28th, and it's going to be at the Roberts Park Pavilion. And we kind of made it into, it's kind of grew into like a little festival type thing. And I hope it takes off because I'd like to do it next year. So I call it the Flues In Cruise In.
Oh, that's neat. So you are great with names.
So
are you their marketing director too? You should be.
Well, I got to give a shout out to Alvin Day. He does a lot of our stuff.
Alvin?
Yeah, he does a lot of our advertising at the health department. He does it on the Facebook, and he works on our webpage and stuff. So we're going to have a mobile flu clinic, and then naturally we'll have healthcare vendors there. And then we'll have craft vendors and apparel vendors and just different sorts, some flowers and things like that. And then a couple food vendors. But then we're also going to have a car show. And we're going to have a sock hop dance. So we just kind of turned it into a little party.
Yeah.
So, but it's, I mean, the main thing is it's for a mobile flu clinic. And all they need to do is just show up, and we can run their insurance information and give them a shot on right there at the party.
Yeah. So again, you guys cover a lot of ground that people. And again, when we think of health department, I always think of the physical, but again, the mental health aspect of everything as well. When you talk about Fayette County being 90 out of 92 counties, and why do you think that is?
Gosh, I don't really know. I mean, I think. I think economy, I think the job market, I think people probably don't have the right guidance. Yeah. And it's out there, it's just, and that's why down at the health department, we have all sit around and discussed that we need to raise the bar up and let people know that we offer all of our services every day, all day long, and except for labs, But we're working on that. Once we get that going, we'll
is that a manpower issue mainly with the labs?
Yeah. So, but also down at the health department, we do have like different areas. We have the environmentalists, and then we have food inspection, and then also people. We do a lot of the birth certificates and death certificates. Yeah.
I guess I knew that. I think
we give out the food vendor permits and.
I guess you would do that, wouldn't you?
Yeah. So.
Yeah, and is that through like the health inspector?
Food inspector,
Food inspector, yeah.
And that's at Bruce Price at the moment.
Oh, Bruce is? Yeah, I like
and
Bruce.
Matt Shirk, he's our administrator and lead environmentalist. Yeah. And then we have Alvin Day, he's our emergency preparedness. And then we have Barbara Tipton, she's our office manager. Becky Gibson is our office clerk, and then our nurses, we have Kelly Fagan, she's the other full-time nurse. Gail Markham, she's a part-time nurse, and Sue Flynn is a part-time nurse.
You remember them all?
Yeah, I have to.
Yeah, good for you.
You'll be mad at me.
Good for you. And there's like a doctor that's ahead of the...
Yeah, Dr. Whitey.
Dr. White still is?
Yeah, he's our health officer.
Yeah.
So, yeah.
Yeah, so...
He's been there, gosh, I think 35 years, maybe.
Oh, wow.
He'll brag on that, too.
Well, he should.
Yes.
He should. And you should, too.
He's a great guy.
You should, too. As we got about a minute to go before we wrap up here, I'm sure it's gone by pretty quick for you.
Yeah, it did go quick.
Yeah, I told you. Any final words that you would like to say before we sign off?
Just anybody that needs any help health-wise, or even just questions if you're curious about anything. What I don't know, I can find out.
Yeah.
I'd be more than happy to sit down in the office with you if you want to come in and need to, a lot of people always still have questions about the COVID vaccine, anything about the flu, anything about even children's immunizations, because that's probably our main thing is the vaccines. So, but if there's anybody that needs any help getting any resources, we're more than happy to help you. We can provide healthcare products to you. If you're having financial trouble, we're there to help. So.
Yeah. Oh,
I'm done.
She's there to help. Missy Kavanaugh, go see her at the Fayette County Health Department. Also, ask her about how to become a balloonatic. All right, catch her at the Health Department. We'll catch you next month on The Spot.